Good morning, and thank you very much for the opportunity to present micronized purified flavonoid fraction, or MPFF, to protect venous and lymphatic function in weightlessness. Here is my disclosure. And let's start with the summary of the weightlessness impact of the human body. First of all, body fluid is redistributed with approximately 2 liters, shifted from the legs to the head, neck, and upper torso within 1 to 2 days in the space. Plasma volume decreases by 10 to 17%, cardiac output increases by 23 to 25%, and stroke volume by 19 to 21%. Another major change is the increase of the oxidative stress and inflammation. Space radiation might represent a big issue, especially for long space trips, leading to DNA damage, reactive oxygen species, and non-specific oxidative damage, and epigenetic changes. All these result in genome instability, mutation, and tumor-promoting inflammation. Space flight-associated neuroocular syndrome, SANS, is defined as unilateral or bilateral optic disc edema, globe flattening, choroidal and retinal folds, hyperopic refractive error shifts, or focal areas of retinal ischemia. It affects up to 40% of astronauts. There are multiple theories explaining SANS. Among them, the increase of intracranial pressures from cephalad fluid shifts, compartmentalization of cerebral spinal fluid within the orbital optic nerve sheath, and variations in the genetic of enzymes of the 1-carbon metabolic pathways. The example of it is methylene tetrahydrofolate reductase, leading to vitamin B insufficiency and uncoupling of endothelial nitric oxide production. Space and terrestrial industries benefited from each other's discoveries. Example here, the marathon runners using the space blankets. Another example, private industry provided Teflon, material reducing friction with wide applications on Earth and used for the heat shield and space suits. Another example, Velcro or velvet hook, invented by the private industry as a fastener and helping to anchor astronauts' equipment. Now, how can another terrestrial product, micronized purified flavonoid fraction, help astronauts counteracting the weightlessness and space-related health threats? MPFF is composed in 90% by diosmin and in 10% by hesperidin fraction, with hesperidin, diosmetin, linarin, and isoroifolin. The main mechanism of action is the inhibition of cell adhesion molecules with NADPH oxidase inhibition and decrease in reactive oxygen species production. It translates into clinical benefits: reduced leukocyte adhesion, inflammation, and microvascular permeability, reduced edema, improved venous tone, capillary and lymphatic function, leading ultimately to improved chronic venous disease symptoms and quality of life. I will present these properties and scientific evidence following this schema for chronic venous in lymphatic disorders. And we will start with the initial stage characterized by venous hypertension and inflammation. In a model of venous hypertension, MPFF significantly improved microcirculatory changes, was more effective than diosmin alone, and was the only drug to prevent venular enlargement with synergistic effect of diosmin and the active flavonoids of MPFF. Venous tone, expressed as Vein's elastic modulus in patients with symptoms of chronic venous disease, was significantly improved after 4 weeks treatment with MPFF as compared to control. Markers of inflammation were extensively studied in patients with chronic venous insufficiency and showed the involvement of leukocytes adhesion molecules such as intercellular adhesion molecule 1, ICAM1, vascular cell adhesion molecule 1, VCAM1, and vascular endothelial growth factor. MPFF significantly decreased the levels of vascular endothelial growth factor in chronic venous disease patients with skin changes and reduced the levels of ICAM1 and VCAM1 and mitigated the inflammatory reactions in a dose-dependent manner. A study of antioxidant balance in women with varicose veins demonstrated the decrease in levels of pro-inflammatory cytokines, endothelin-1 and tumor necrosis factor alpha. In a granuloma model, MPFF reduced edema formation and inhibited synthesis of prostaglandin E2, F2, alpha, and thromboxane B2. A reduction in cell migration towards the inflammatory focus and improvement in histological aspects of the acute inflammatory reaction were also observed. The analysis of blood lymphocytes from patients with chronic venous insufficiency compared to healthy controls revealed increased oxidative DNA damages and a significant beneficial effect of MPFF reducing these DNA damages. A diabetes experimental model served to study the oxidative stress and confirmed the protective effect of MPFF. The authors suggested that MPFF should be complementary treatment for prevention of diabetic microangiopathy. Let's go back to Sand's theories involving methylene tetrahydrofolate reductase and uncoupling of endothelial nitric oxide production. As MPFF has favorable impact increasing NO and decreasing reactive oxygen species, in spaceflight associated neuroocular syndrome, we could expect a counteraction at the endothelial dysfunction level, with improvement of microcirculatory permeability and the reduction of edema. In the later stages of chronic venous disease, MPFF was proven to decrease the reflux flow rate across the saphenous valve after 3 weeks of venous hypertension in the experimental model. In the randomized controlled trial versus placebo in patients with chronic venous disease and edema, the venous reflux time measured with ultrasound was significantly reduced in the MPFF treatment group. An in vivo model of hamster cheek pouch was developed to study different substances' effects on the microcirculation. In this setting, ischemia followed by reperfusion provoked capillary hypertension and leakage that was visible thanks to the administration of a fluorescent product. In this model, MPFF anti-hyperpermeability effect was significantly higher than that of diosmin. Hesperidine, linarine, and isoroifoline had anti-leakage effect similar or greater than that of diosmin. The study confirmed synergistic action of MPFF components, each of them contributing to the compound's efficacy. In the clinical study, including patients with severe chronic venous insufficiency, MPFF improved lymphatic function, increased functional microlymphatic density, and improved microlymphatic drainage by decreasing microlymphatic diameter and pressure. Anti-edema properties of MPFF were demonstrated in several double-blind, randomized, placebo-controlled trials, where leg circumference was significantly reduced in chronic venous insufficiency patients treated with MPFF. Just recently, a meta-analysis of randomized controlled trials of MPFF in chronic venous disease was published. After a systematic review, 7 trials were included in the meta-analysis with a total of 1,692 patients. The authors concluded that based on high quality evidence, MPFF is highly effective in improving leg symptoms, edema, and quality of life in patients with chronic venous disease. A meta-analysis of several veno-active compounds, efficacy in phlebolymphedema, edema secondary to the venous disease, compared their effects on ankle circumference. Almost all were proven to do significantly better than placebo. However, MPFF obtained the best z-scores versus placebo and other compounds. In a double-blind controlled trials in filarial lymphedema, MPFF was also found to be safe and efficacious in reducing lymph volume. The effect of MPFF on post-mastectomy lymphedema was evaluated in a double-blind randomized controlled trial. In patients with more severe lymphedema, MPFF increased lymphatic transport on lymphoscintigraphy, and there was a trend for reduction of lymphedema volume. MPFF was subject of numerous publications, systematic reviews, meta-analysis, book chapters, and was recommended in several clinical practice guidelines all over the world. In conclusion, micronized purified flavonoid fraction, MPFF, is beneficial for the venous and lymphatic circulation by increasing venous tone, decreasing inflammation, oxidative stress, and edema. These properties make MPFF an excellent candidate for astronauts' nutritional supplement to alleviate the detrimental effects of weightlessness and oxidative stress, and to preserve and protect normal venous and lymphatic function. Thank you very much for your attention.